the naturopath. Thank you for looking at my video. If you're new to my channel, please have a look at the videos. There are a lot of videos on this channel now. There's a few thousand on all kinds of topics. The question today is, can Candida always show up on a biopsy? No, it doesn't. In fact, I would say it's not even 50-50. I've seen so many cases of people who had Candida symptoms, the presentation, your signs and symptoms were clearly evident to me that they had Candida, yet their medical doctor did a swab or did a biopsy and couldn't find anything at all. Candida is hard to pick sometimes, depending on the species. It's very difficult, depending on the budding stage or the hyphal stage where it's in. So many factors can account for it evading, detection. Many, okay, the pH, the temperature, whether the Candida is starved or not, what stage of genesis it's in, is it in a growth stage, is it in a budding stage, all sorts of things. Because remember, Candida can also affect the immune system's response. So it's a devil of a little thing to have inside your body. It doesn't always show up. Now, I found this particularly so with vaginal cultures and vaginal swabbing, where many times the doctor would say, look, it's inconclusive, we can't find anything, we think you may have bacterial vaginosis, we don't know what's going on, but yeah, it certainly can be a real issue for people who come back with a negative. I thought over the years the testing would get better, and it certainly has as far as the genetics are concerned and the species excuse me, and also the species. Now we know a little bit more about detecting species, but biopsies are not always a foolproof, guaranteed way, of diagnosing a yeast infection. To me, I tend to look at the case from a different angle, from the way a medical practitioner would, and look at more of a holistic concept of diagnosis rather than just purely off a biopsy. And often the biopsies will come back yay or nay, and then it will dictate what drug that they're going to use or no drug at all. And that's why so many patients end up on my doorstep with Candida, because basically a lack of clear-cut diagnosis, or to be told that basically it was all in their head, they're imagining it all. But these people aren't imagining things. Thanks for tuning in.